Today we are going to discuss about these spinal poisons. So as we all know, toxicology is basically the branch of forensic medicine which is dealing with poisons. Whenever we are studying in detail and moving on with the subject of poisons and studying how these poisons act on our different systems of the body and render some difficulties in the normal functioning and physiological basis of the bodily systems, we must know there are different methods for classification of poisons. One of the most handy method for classifying poisons is the mode of action, or which is also known as the mechanism of action. So we divide the poisons as the poisons acting on the cardiovascular system, naming the cardiac poisons, and today we're going to discuss the specific poisons acting upon our nervous system, and they are basically known as the spinal poisons. When we use the word spinal poisons, it is basically rendering to the fact that these poisons act upon the spinal cord. But sometimes they have their actions on the central nervous system as well. Some of the poisons can cross the blood-brain barrier and enter the CSF, and it can reach up to the cerebral cortex and even to the brain stem, and affecting, obviously the effects would be similar in action. Then we can have poisons which can act upon the peripheral nervous system, involving the peripheral nerves specifically, and their actions would be quite similar to the mode of action or the mechanism of action accordingly. Over here, we must consider this fact that we have to deal with these cases, and the diagnosis of these cases is sometimes quite a confusing picture. You have a long DD, that is the differential diagnosis, which is attached to these patients. So if there is a clear-cut history which can basically be very helpful with whomever brought the patient to the emergency department, the corroborative history over here is very important. How you take the history, and if it is indicating the fact that this is a case of poisoning, then it's sometimes quite easy to diagnose that this is the kind of poison. And again, we can further investigate the case and get to the specific poison in that particular group that we are dealing with. Spinal poisons would have their own specific action. Usually the patients would be brought to you with signs and symptoms quite similar to tetanus. That is, the spasms are very important, or either there would be tonic-clonic convulsions and seizuric effect. But there would be a sustained convulsion, or there would be a sustained contraction of the muscles that would be noted down over here in cases of poisoning. So this is how you basically differentiate. And obviously we have the other features as well, which are quite helpful in distinguishing between whether it is a patient of tetanus, epilepsy, hysteria, or either we are dealing with poisoning. So having this differential diagnosis in your mind is very important, because when you have the patient, it's not always a labeled patient, and you have to investigate further to get to a diagnosis and then obviously manage the case in a particular way. So it's quite interesting that we have these spinal poisons, and the most effective and the most studied poison, theoretically even, are the strychnos, which is also known as Nux Vomica, or basically they are a kind of seeds that we usually have, and they are quite poisonous, and their mechanism of action is basically acting upon the spinal cord over here. So it is basically a quite distinct kind of seeds that we're dealing with. They are biconcave seeds, dull in color. And if the patient gives you this history that these were the kind of seeds found at the crime scene, then it's again very important and very easy for you. Just if you have seen these seeds, it would be very distinctively easy for you to identify that you're dealing with this case of Nux Vomica poisoning, or which is also known as strychnine poisoning. And obviously, the clinical features would highlight the case, and then you can easily distinguish that what is the management or what is the treatment guidelines that you have to follow on in this particular case. Moving on, we'll be discussing curare. Curare is one of the poisons that we usually deal with. It is a kind of poison which is acting upon the peripheral nervous system. And what are the signs and symptoms, the clinical features, that would be discussed in detail over here. And then obviously we have another very important poison which is included in this group, which is known as Conium Maculatum. Now, Conium Maculatum is also known as hemlock. So this is a common name. This is a layman terminology which is usually used by the people, and it has its distinctive leaves. So it's easily identified if it is found by the people who brought the patient to the emergency department, and they're giving you this particular history that these were the kind of leaves, and sometimes they bring those leaves along with them. So it would be very easy for you to identify what kind of a spinal poison has been used, because they have their own antidotes, they have their own management guidelines. So knowing and getting to know the particular or the definitive poison used in a particular case or is very important to deal with. Then obviously you have to move on with the past history is very important. How you take the past history, the family history is very important, because that is even going to highlight the fact that if the patient is suffering from any comorbid conditions or not. For instance, we have epilepsy that has its genetic contributions. We have hysteria, which is basically going to be linked to certain sort of a post-traumatic stress disorder. So these are the kind of histories that you would be having, and they are sometimes linked to a particular kind of a diagnosis. So having a past history, having a past medical history, if the patient has been admitted to the hospital or there have been frequent admissions in the recent past, what was the cause of that frequent admissions, that they're going to be highlighted over here. If the person is allergic to some sort of a food, drug, that is even important over here. When I say that we're going to focus on the drug history as well, why is that important? There is a syndrome which is known as PISA syndrome, and it has its clinical features quite similar to strychnine poisoning that we would be studying. Having the rhizus sardonicus, that is the mimicking grin due to the sustained contractions in the muscles of the jaw. And then we have the opisthotonus and the emprosthotonus, pleurosthotonus, all of these tonic conditions in which we have sustained muscular contractions. They're even seen in this PISA syndrome. And it is not due to any kind of poison, any kind of strychnine, curare, conium poisoning, or even when you carry out the investigations, the patient is not tetanic, the patient has no history of hysteria, and even he's not suffering from any kind of epilepsy. So what would be the cause over here? A group of drugs known as antipsychotics, which are also known as neuroleptics, they sometimes cause this kind of a condition when they are given on a very prolonged period of time. So that is basically included over here, and it can be one of the differential diagnoses. A very rare condition, but obviously you're going to keep it at your hand, in your mind, and then obviously investigate the case accordingly, whether the patient is suffering from this syndrome or not. Has he been on any kind of antipsychotics for a very prolonged period of time or not? So this is going to clarify the picture more and make it easier for you to get to a definitive diagnosis if it is a very confusing state of contractions, sustained contractions, systemically, or even involving a certain part of the body, muscles of the back, muscles of the front, or even the lateral muscles of the thorax are sometimes involved in these kind of sustained contractions. And obviously, whatever the cause is, if the cause is involving the respiratory system, the patient can go into respiratory distress, respiratory failure, and eventually the death of the individual occurs. So it's quite a critical condition, and getting to a definitive diagnosis is very critical over here. Moving on with the clinical features of all of these spinal poisons. First of all, the most important, we have the strychnos, which is commonly known as Nux Vomica. So Nux Vomica, basically, when we look at the plant of Nux Vomica, it is a tree with fruits, and it is basically seeming quite edible. All of the parts of the plant are not poisonous. It's basically the seeds, the biconcave seeds, that are the poisonous part of the plant. And even a more interesting fact, which is attached to these seeds, are that basically if you take the unbroken seeds, they are not going to be proving poisonous for the individual, because the covering of the seeds is insoluble. Even if it is ingested as such, it would cause no harm to the individual. So it's just the broken seeds, it's just the chewed seeds that would prove to be poisonous for the individual. So it's a very important fact that you have to keep in your mind. Once the broken seeds, once the chewed seeds are taken by an individual, and usually orally, of course, and it enters into your system, what will happen is basically the patient, the symptoms would develop within a time period of 15 minutes to almost 1 hour. So this would be the time duration in which the symptoms would start appearing. The patient would have sustained contractions. First of all, there wouldn't be a full-fledged picture just initially. Just sustained contractions, just the twitching of the muscles would be observed by the individual. The small muscles are involved first of all, and then it is going to involve the different systems of the body eventually. Then obviously there's going to be a period of relaxation that is followed on after the period of contractions, and it is going to prove very fatal for the individual. Any sound and any movement in the surroundings is going to elicit a contraction which can prove to be fatal for the individual. So it is basically quite a horrific picture, a state of emergency for the doctors. As a medical officer, you should be quite vigilant to diagnose these cases and basically have a differential diagnosis in your mind. Other conditions, tetanus, epilepsy, hysteria, obviously all of these are also to be kept in mind when you have that patient. Run the tests accordingly, clinically examine the patient, and obviously take the history in detail from the patient. A lot of facts would be highlighted over here. The history is going to be of an injury when it is a patient of tetanus. On the other hand, the history is going to be of a poison intake, or the intake of any fruit or any basically edible substance, and that was basically mixed up with the seeds. And after that, the patient presented in such a condition. So there would be a particular history in both of these cases. That is one of the differentiating fact over here. Clinically, when you examine these patients, there is going to be a fixed chest respiration in cases of Nux Vomica poisoning, and on the other hand, we have tetanus, in which there is going to be a sustained contraction. There are going to be phases of relaxation. Between contractions, there are going to be phases of relaxation in cases of Nux Vomica poisoning, and on the other hand, when we examine the cases of tetanus, the periods of relaxation won't be quite feasibly found in these cases. The fatality rate is quite more in cases of poisoning, and on the other hand, in cases of the tetanus, the fatality rate won't be that much higher in those cases. So this is a picture that would make it quite clear for you that these are the points that you have to keep in mind: the history, the clinical examination, and then obviously you would be sending the blood test for the lab investigations, and that is going to further clarify the picture for you and help you get to a definitive diagnosis in case of contractions, tetanus, rhizus sardonicus, and all of the features that are basically a part and parcel of both of these conditions. So moving on, we'd be discussing the active principles that are a part and parcel of the poisonous part of this plant, mainly the seeds that we discussed. So all of the parts of the plant are not poisonous. It's just the seeds. The biconcave grayish in color seeds are the most poisonous part of this poisonous entities that this plant is having. Now, the active principles are strychnine, 1.5%. We have brucine, which is almost 1.5%. And then we have loganin, which is a glycoside. And again, we have to keep this thing in our mind that the shell or the outer covering of this seed is not soluble by the digestive juices. And that is why only the broken seeds or only the chewed seeds are going to prove poisonous for a human body. So these are the facts that we have to consider when we have this Strychnos Nux Vomica poisoning. The medico-legal importance of this plant is to be considered over here. So we must know that what are the industrial uses, what are the clinical uses, if there are any, of this plant, and how can basically it can cause an accidental ingestion of this poison, or either can it be a homicidal aspect which is attached to these seeds, or can it be a suicidal poison or not. So these are the aspects that we have to consider whenever we are going into the details of the medico-legal importance of any seed that or any poison that we have. Mostly, an accidental form is associated with strychnine poisoning because of the fact that it is basically a strong alkaloid, and it has its industrial uses out there. So usually it can be an accidental poisoning which is attached to it. It's a respiratory stimulant, so it can be used in a lot of cases as a respiratory stimulant, and there is a thin line between the poisonous doses of the stimulant and then we have the therapeutic uses which are attached to this kind of poison as well. Nux vomica seeds are also used for killing stray dogs. So this can be one of the uses, and obviously when it is used for that purpose, it can be ingested accidentally by the children or by the elderly individual, by the people who may confuse it with some other substance and they accidentally ingest this poison, and that can result even in the death of the individual. Then we have rodenticides. It is one of the aspects that we have to consider, one of the industrial purposes. So even if we are using the Nux vomica seeds for the domestic purposes as a rodenticide, or either they're used as a rodenticide in the industrial fields, in the agricultural fields, it can be ingested by accident and can result in the death of children or mentally insane individuals. They can have the ingestion of these Nux vomica seeds, and they can present to you in the emergency departments with a condition of tetanus and convulsions, sustained spasms in the muscular system. The respiratory system might be involved, which is going to end into the fatality of these individuals. Then the strychnine, as what is the metabolism? How is it excreted out of the body? What is the fate of this poison? That is going to be discussed over here. The mucous membranes mainly it is going to affect. It can even affect the muscular system of the body. It can affect the liver. So it is basically, if it is affecting all of these systems, it can end up in the convulsions. It can end up in the excretion out of the body. It is excreted by kidneys or either by saliva. Traces are found in the saliva of the individual, or it can be even excreted by the bile. So these are the excretory routes. Why is it significant that we know these routes? Because that is how it is going to be detected that this is the poison that we're dealing with. If we have the bile, if we have the urine, if we have the saliva, we can take that to the histopathologist and he can basically further clarify the situation that what is the kind of poison that we're dealing with, and it can be easily found in the saliva of the individuals over here. So this is the way we detect this poison in the excretions of the human body, and this is how we detect this poison, and finally obviously get to the management and the treatment guidelines over here. The mechanism of action which is involved mainly over here, it is going to stimulate the cerebral cortex. Then finally it can even block the anterior horn cells of the spinal cord. Mainly when we talk about the anterior horn cells, it is involving the post-ganglion receptors in the spinal cord. If we just remember the structure of the spinal cord, we know that we have the anterior horns and then we have the posterior horns of the spinal cord. A lot of thalamic tracts, that is the ascending and the descending tracts, are basically found in the cut section of the spinal cord. It can involve the gray columns and it can involve the white columns, and the poison that basically the Nux Vomica that we're dealing with in over here, it is going to affect the anterior horn cells specifically, and obviously the postganglionic receptors in the spinal cord are also affected over here. It is going to prevent the effects of glycine as well, and basically it is an inhibitory transmitter over here. The inhibition of spinal cord is done, and these are basically the major 4 mechanism of actions that we can have in cases of strychnine poisoning. Now, what will happen if the strychnine is taken uncrushed and if it is not chewed? Unbroken seeds are taken. If it is swallowed, there is going to be no poisonous action at all, and they can be basically excreted as such through these stools, and it is not going to harm the individual at all. So this is a very important fact that is associated with Nux Vomica, or that is associated with strychnine poisoning over here. Then the crushed swallowed symptoms are going to appear within an hour, and they can even develop if it is a higher dose of strychnine poisoning. If it is a higher dose of Nux Vomica poisoning, they can even appear in less than 15 minutes, but it can usually take almost an hour to develop a full-fledged picture of strychnine poisoning that we're going to discuss. Having the rhizus sardonicus, having the back muscles of the back are also involved. Muscles of the lateral thorax are involved, anterior thorax are involved, and anterior abdominal muscles are involved. So all of these muscles can be involved and give you a particular picture of strychnine poisoning that is associated over here in a typical case of Nux Vomica poisoning. Alkaloid, if it is swallowed, then it is going to take almost 5 to 15 minutes. So the most potent of the poison over here is the alkaloid that is a part and which we basically named as glucine, and is basically one of the active principles of the Nux Vomica seed over here. So these are the points that we have to consider whenever we have these cases of strychnine poisoning. The symptoms of strychnine poisoning would have that the patient would complain of a bitter taste in mouth. So this is one of the very distinct feature over here. Then obviously the signs and symptoms and the clinical features also include an uneasiness which is observed by the patient even himself, and he's quite restless even if you'd observe the patient on a whole. So having a keen observation is very important over here. Then restlessness, as I've already mentioned, then suffocation is one of the clinical feature that the patient would complain of. It is a symptom basically. Moving on, we have difficulty in swallowing, known as dysphagia. Face seems to be quite cyanosed. Now, how are you going to distinguish that the face is getting cyanosed? The lips, the peripheries, the corners of the ear lobules are basically the parts of the body that is basically going to indicate the fact that if there is a bluish discoloration, that is going to highlight the fact that the patient is having cyanosis. So this is a very common feature that you have to consider. Then dilated pupils is one of the sign as a medical officer when you would examine these patients. A lot of even other poisons have this kind of a feature, as we have even studied in the previous poison that was, as you can even recall in the previous lecture of cardiac poisons, we discussed aconite, and there we even studied this feature of a dilated pupil, which was basically associated with the hippus formation. This was a very classical sign of aconite poisoning. So it can be a confusing picture sometimes, and you should basically make a list of poisons in which you can find a dilated pupil. Even we have other poisons in which we have pinpoint pupils, or which are also known as constricted pupils. So basically, having a distinctive list in your mind can make the diagnosis and can make the investigation more easier for you as a clinician. Eyes seem to be staring, so this is one of the feature. Then we have rhizus sardonicus. Rhizus sardonicus is having a sustained abnormal contraction of the jaw muscles, giving you a grimace kind of an appearance, a false grin basically. So this is a very peculiar feature even in cases of tetanus. When we study tetanus in the pathological basis, we find out the different features of the Clostridium tetani, giving you the features of Rhizus sardonicus, and even the other features that we'd be discussing. They're quite mimicking the picture of tetanus and epilepsy. Again, we just went through the different distinguishing features over here. How can you distinguish the fact that we're dealing with tetanus, or either we are dealing with the cases of strychnine poisoning, and how are you going to basically deal with this kind of poison is very important. So there are these peculiar features, the clinical features, the history taking is going to highlight the fact in cases of tetanus, the patient is going to have the history of injury in the recent past. Within 24 or 48 hours, the patients usually develop the tetanic features. So injury, the history of injury is going to be there in cases of tetanus. And on the other hand, the history of ingesting something is going to be there when we are dealing with cases of poisoning on the other hand. So this is one of the key feature over here. Moreover, we have blood in mouth. So this is one of the feature. Bleeding gums is one of the feature. Opisthotonus is a very interesting clinical feature associated with strychnine poisoning, in which basically the muscles of the back get in a contracted, sustained position, and it can give you a picture, classical picture of convulsions and opisthotonus. So when does this basically clinical feature appear? And basically, a lot of patients with hysteria, psychological symptoms, have this peculiar picture of opisthotonus or even emprosthotonus. You must have seen a lot of movies which are basically featuring people who are possessed, and they are usually in this phase of opisthotonus, and sometimes a lot of patients basically who are in this phase of opisthotonus are seen due to the fact that they can be in a phase of hysteria, and in a phase of hysteria, the muscles of the back, the muscles of the lateral thorax, the muscles of the lower abdomen and the anterior thorax are involved, and they go into a sustained contraction, and they give you this horrific and horrifying picture in which you can sometimes suspect that the person is possessed, which he or she is not actually actually suffering from. And basically the cases are of tetanus, or either they are having some sort of a psychological issue. People having hysteria are usually presented in this kind of a position, and even in strychnine poisoning, people are presented in this similar posture which is quite horrifying. So then we have the people who have this emprosthotonus, in which the patient is basically having the flexed movements. So it's not the extension, it's the flexion, and there's going to be a forward diversion of the upper thorax and the limbs, and this this position is basically known as emprosthotonus in the individuals. Then we have pleurosthotonus. Pleurosthotonus is basically the sideways deviation either to the right or either to the left, and usually when you examine the patient from the back side, it is quite evident, and this posture is known as pleurosthotonus. Again, the cause over here is the sustained contractions, the abnormal sustained contractions of the lateral thorax and the abdomen are basically causing this pleurosthotonus in the individuals. So this is a group of picture, a collective picture is present over here, and between these sustained contractions, there is a phase of relaxation which is even seen in these patients. So this is quite evident over here, and you have to even keep that in your mind over here. Then we're going to deal with convulsions. So the acuity of perception is very important over here. What is the type of convulsions? Either they are the tonic-clonic convulsions, because that is going to distinguish the fact that whether the patient is suffering from epilepsy or either he or she is suffering from the strychnine poisoning over here. Moreover, we have muscle rigidity, which is quite evident in these cases. We have muscular twitching, which if we have a keen observation and we're looking at the patient, we're going to see that the patient is having this muscular twitching. We have convulsions in the anti-gravity muscles. Spasms are noted down. Difficulty in breathing is very evident over here. And then we have the contractions of the thoracic muscles, which we have already mentioned is going to give a state of emprosthotonus, opisthotonus, or even pleurosthotonus to the individual. So this is going to be the typical picture when we are looking at the patient. Hypoxia-induced medullary paralysis is one of the clinical condition over here. Now, having this kind of convulsions and having this multiple picture over here, again with all of these complications, is going to highlight the fact that this patient is suffering from strychnine poisoning and help you out in the correct diagnosis of the individual. The fatal dose that is associated with strychnine poisoning is 50 to 100 milligrams, and again, keeping in mind the crushed seeds are going to cause the poisonous condition or the harmful effects in the human body, and not the solid seeds. Then we have the fatal period, which is almost 1 to 2 hours. So a full-fledged picture would be seen in a patient who has ingested the crushed seeds in the amount of almost 50 to 100 milligrams, and almost a time period of 1 hour has passed on. Then it can even cause the fatality in the individual. So this is the time duration that we have, where we have to act very vigilantly and basically help to give the supportive environment to the individuals. So discussing the treatment and how do you manage these cases, and again, as forensic specialists or forensic practitioners, one should know what is the post-mortem appearance. That is most relevant for a forensic personnel to have the specific knowledge regarding the post-mortem appearance of these individuals who have ingested strychnine and death has ensued in these individuals. So strychnine poisoning is going to cause rigor mortis very quickly in the patients, and that is something that is going to happen in every death. So these are the changes after death, but it is going to fasten up the process of rigor mortis development. That is the tetanizing effect, the convulsions, the spasms that are produced even normally after death in all of the individuals. But over here, if it is a case of strychnine poisoning, it is going to develop more quickly in these dead bodies. Then asphyxia is one of the cause of death which is going to resemble these cases, because as I've already mentioned that people who have ingested strychnine and it has basically caused fatalities in these individuals, they're going to have bluish discoloration that is given to the face of these patients. So that is even present in cases of asphyxia. For instance, strangulation, mugging, Bansdola. These are different methods that is in which the patient is going to asphyxiate, and the signs of congestion, the signs of cyanosis are going to be seen in these patients. Extravasated blood in muscles is found, and then we have hemorrhages in peritoneal coat of the stomach. So when we examine the stomach and then we send it for the histopathological examination, it is going to highlight the fact that it is having a dot and blot appearance. Hemorrhages are found. So this is one of the characteristic features over here. Then ecchymosis and congestion in stomach is found, and even when the liver is examined in detail, the patient is having liver congestion, lung congestion, brain and spinal cord congestion is even seen over here. So these are the peculiar features that you're going to note down, and they're going to prove very handy to you when you are going to diagnose, or whenever you are performing these postmortems in your practical fields, and you have these cases, you find these signs. They're going to basically point out towards the fact that the cause of death was strychnine poisoning in these cases. The peripheral nerve poison, as I've already focused on the fact that the strychnine poisoning that we studied is one of the example of the poisons that are acting upon the spinal cord. But when we talk about the poisons that act upon the peripheral nervous system, the most distinguished of these poisons is the Curare poisoning. So this is how the plant looks like. It is a very common plant, and so this poison is going to act upon the neuromuscular junction distinctively. It has its own mechanism of action. Again, it is going to act upon the nervous system, so it is included in this classification as we are studying it. So the mechanism of action of Curare poisoning, the active principle over here is curarine, and it is going to act upon periphery at the myoneural junctions, also known as the neuromuscular junctions. The uptake of the acetylcholine is basically inhibited over here, and it blocks the postsynaptic nicotinic acetylcholine receptors as well. Which is going to act, or which is going to result in the flaccid paralysis in these individuals. And mostly the muscles that were affected by this action is the skeletal muscles, and this is how it is going to basically cause paralysis. So this is again a distinguishing factor. We studied that in strychnine poisoning, we dealt in with a kind of a spinal poison which is going to cause the tetanus. So this is something quite distinguishing. Clinically, when we'll be looking at these patients, on one hand, the patient is going to have flaccid paralysis, and on the other hand, the patient is going to have the tetanic spasms. So this is quite a distinguishing picture. Although both of these drugs belong to the group of spinal poisons, their final clinical picture is going to be quite distinct in both of these cases. Then the symptoms, discussing the complete list of symptoms, we have paralysis, and then we have mydriasis, and we have the liberated histamine in these cases. And on the other hand, the death is basically causing because of the fact that the respiratory system is involved, and it is going to give you a mixed picture of deaths from asphyxia, strangulation, garroting, mugging, or even hanging. These are going to be the mixed pictures. These are going to be a part and parcel of the differential diagnosis, because even over here, the respiratory system shuts down, and there are going to be features of asphyxia seen in these patients as well. So this is one of the clinical feature that is quite distinguishing over here. The paralysis is going to be of the flaccid type, as you have to note down in the clinical features or in the signs and symptomatologies. Fatal dose is almost 60 milligrams in cases of Curare, and the fatal period is almost 1 to 2 hours in this particular case. The treatment that is associated with this Curare poisoning is we can administer atropine that is almost 0.6 to 2 milligrams in these cases, and is a life-saving antidote that is administered because it is again going to act upon the neuromuscular junctions, and the mechanism of action is going to be reversed in these cases. Neostigmine almost 5 to 10 milligrams is one of the antidote which can be even administered in these patients. Then we have physostigmine, which is almost administered in a dose of 3 ml of 1:200 solution, and this basically physostigmine, it is administered IV, that is intravenously to the patient. So this is a complete treatment guideline that we have. If we have a live patient and we can perform the life-saving procedures, we'll be giving out this treatment or handing over this treatment to the individuals. Now, the post-mortem appearances in the Curare is the, first of all, we have to consider asphyxia. So cyanosis is one of the feature, the bluish discoloration, the congestion that is noted down on the face. All of these are the features. Even the patient can have the petechial hemorrhages in the eyes. So these are the features of asphyxia, and they're even seen in the Curare poisoning. So one of the major associated features is the arrow poisoning. So in the past, basically, it was used to basically cause the cattle poisoning, and it was even used on the bow and arrows. So this is one of the poison which was used on the arrows and caused the death of the different human individuals. So another poison which is quite notorious over here is the Conium Maculatum, which is also known as a common name which is given to this poison is the hemlock over here. So this is how it looks. It is basically greenish in color. The plant is poisonous, and all of these portions are basically poisonous. Again, it is one of the variety which is acting upon the peripheral nervous system. So it is included in this important list of spinal poisoning that we are studying today. Then we have the Conium Maculatum, and how it is basically acting upon the human body and causing the harmful effects in the human body, as it contains the quinine. It is the active ingredient over here, and the fatal dose is almost 60 milligrams of quinine in this case. The symptoms included are specifically a nauseating taste is subjacent to it, and then there is a specific distinctive discrete odor which is basically a mousy odor associated with it, and is going to cause motor paralysis in the patients. So over here in this lecture, we discussed a very important group of poisons, which is the spinal poisons, whether they are acting upon the spinal cord, the central nervous system, or either they are acting upon the peripheral nervous system. They are going to cause paralysis in the individuals. Two distinct varieties of the paralysis, and then how are they going to affect the post-mortem appearances as well, because as forensic practitioners, you should be well versed with these conditions and how do they develop and what are the distinctive signs of these spinal poisons. So that is the end to this lecture. Thank you for watching sqadia.com.